Hi, greetings. I am going to give you a brief detail about communication in palliative care, breaking bad news, collusion and denial. This presentation is prepared by Dr. Harpreet Kaur, Professor, Department of Community Medicine, Sri Guru Ramdas University of Health Sciences, Sri Amritsar, and also a member of the Punjab State Chapter of National Association of Palliative Care for Ayush and Integrative Medicine. The contents of the slide are introduction, definition of bad news, situations, how to deliver bad news, steps, model and denial. Communication is an important component of delivery of palliative care. Communication can be either effective or ineffective. Breaking bad news is an important aspect of communication. Task of breaking bad news. As per Buckman, if we do it badly, the patients or family members may never forgive us. If we do it well, they may never forget us. I will read out again. If we do it badly, the patients or family members may never forgive us. If we do it well, they may never forget us. Which news is bad news? Any news that adversely and seriously affects an individual's view of his or her future. Bad news is information that has an adverse and serious effect on an individual's view of his or her future, noting that bad news is always a subjective appraisal by the individual receiving the news. Why deliver bad news? Patients have the right to know about their disease. It permits patients and families to plan their life or the remaining part of their life. Knowing the truth allows the patients to cope with the disease, reduces uncertainty and anxiety, avoids false hope, builds trust between the patient and the physician. It helps compliance to treatment. Situations which require breaking bad news. Life-limiting serious illnesses like cancer, HIV, etc. Life-altering serious illnesses, example rheumatologic illnesses, diabetes, hypertension. Degenerative diseases, for example Alzheimer's disease. Do the following: allow time, ensure privacy and confidentiality, use simple language, let the patient talk, listen to what the patient says, be sensitive to the non-verbal language, allow for silence, tears and other patient reactions. Avoid the following: overloading information, distorting the truth, giving false reassurance, feeling obliged to keep talking all the time, withholding information, assuming that you know what is concerning the patient, criticizing or make judgments. Responses to bad news: denial, shock, anger, guilt, agitation, helplessness, anxiety. Barriers of breaking bad news: fear of their own emotions, fear of patient and family or caregiver emotions and reactions, uncertainty in how to support these responses, communicating information in technical language that is not easily understood, avoiding discussion of distressing information, giving false hope. Fear of what might be said, not feeling prepared, feeling that people are not being truthful or honest, may have differences in what information they want each other to know, may have a need to seek a second opinion, may have limited understanding of medical or physical processes, may be embarrassed by own lack of knowledge. The process for breaking bad news: first comes elicit person's understanding, that does person know or suspect the truth? If it is no, fire warning shot. Break news at person's pace in manageable chunks. Acknowledge immediate reactions. Allow person time for initial shock. Deal with emotional reactions and questions. Offer support. If it is yes, explore level of knowledge, confirm news at person's pace and follow the remaining. Approaches to deliver bad news. There are many approaches that are being followed to elicit information. ABCDE protocol is there as per Rabo and McPeace. Spikes protocol by Bale and Buckman. Breaks protocol by Vijay Kumar Narayanan, Bibek Bista, Cherian Koshi. ABCDE protocol by Rabo and McPeace. A stands for advanced preparation. B. Build therapeutic environment. C. Communicate well. D. Deal with patient and family reaction. E. Encourage and validate emotions. Breaks protocol. B for background. R. Rapport. E. Explore. A. Announce. K. Kindling and S. Summarize. Spikes protocol, the 6-step protocol for delivering bad news. We have the setting, there should be some social worker, minimize distraction, sit down. Perception, what do they know so far? We should understand it. Invitation, break it down a little at a time. Knowledge, be direct, use plain language. Empathy, keep your cool, safety first. Summary, reiterate patient wishes. This is Spike's protocol. Step 1, setting up the interview. Get the physical context right. Maximize privacy. Avoid interruption. Establish rapport with the patient. Respect confidentiality and provide support. What? Detail information about the patient. Where? Arrange for some privacy. Who should break the news? Starting off, introductions and appropriate opening. What can be done? Details of the patient's illness should be sought for the following: diagnosis, patient's clinical history, investigation results, plan of care and prognosis, support system for the individual. Assessing the patient's perception. Find out how much the patient knows. Listen to the patient. Accept denial. Confrontation to be avoided at this stage. How it can be done? Inquire from the patient. What do you know about your disease? What did the doctor tell you? Obtaining the patient's invitation. Ask the patient whether he wants to know the details of medical conditions. Accept the patient's right not to know. Offer to answer questions later as a wish. Inquire from patient, what you like me to explain further about your disease. Note patient's expression. If responsive person, please tell me. Then proceed to share the information. Giving knowledge and information to the patient. Deliver the message. Use plain language. Be mindful of body language. Get to the point. Give information in small chunks. Pause. Wait for reaction. Give diagnosis, example cancer, etc. Give any positive aspects like cancer has not spread. Examples of warning shot. You seem to have a swelling or wound which is not the usual type. Pause. Observe patient's expression. Wait for the response and proceed. If the response of the patient, does it mean it is cancer? The answer should be, the test results show that it is cancer. So, very intelligent type of answering. Addressing the patient's emotions with empathetic responses. Prepare to give an empathetic response. Be prepared for patient's emotional response. Anticipate fear anger, denial, sadness and guilt. Be mindful of your own response. Comfort the patient. How it can be done? Avoid giving false hopes. Don't worry, everything will be all right. Don't tell like that. Guidelines for responding to patient's reactions. Acknowledge the reaction. Example, patient says, I knew it. I knew when I was not getting better while the doctor was giving me only medicines all the time. Response should be, I can see how angry you are feeling that your disease should have been diagnosed much earlier. Allow the patients to express feelings. Help the patient to take a decision. Allow the patients to express feelings. Help to ventilate feelings so that stress is relieved. Help the patient to take a decision. Give options. Explain what can realistically be done to suit his needs. Remain silent if we do not have an answer. Strategy and summary. Assess patient's readiness for planning. Negotiate next steps. Verify support structure. Acknowledge and answer questions. Close the interview. How it can be done? Inquire from the patient. Are there any points which you would like me to explain more? The plan for ongoing care and support should be drawn up with the patient if the patient is ready for a discussion. This is a video and the link will be viewed. Denial. Denial is an unconscious mental process that acts as defense against anxiety produced by an external threat. Denial is an unconscious mental process that acts as defense against anxiety produced by an external threat. That is the definition of denial. Not wanting to know the diagnosis is a form of denial. Denial is part of normal coping mechanism. In case of denial, explore the reasons. Do not be combative. Appreciate if there is an information gap. Try to educate the patient. Empathize with patient. Check the patient has a clear understanding of the problem. Give time to adjust to new information. Collusion. Collusion is the act of shielding information from the patient or family. It is called as collusion. In healthcare, collusion implies any information about the diagnosis, prognosis and medical details about the person who is ill being withheld or not shared among individuals involved in care. Relevant and complete medical information is selectively or not disclosed at all to patients and their relatives. Collusion is generally an act of love or a need to protect another from pain. Colluders will often argue that they know the patient better than the healthcare professionals do and know what they can take. They may also hold the view that telling the truth to the patient would take away hope. How to deal with collusion? Find out what the primary concerns of the family are, acknowledge their concerns and feelings, explain the benefits and of telling the truth, outline the possible harmful effects of not telling, if necessary challenge in a non-offensive manner, assure the family that the diagnosis will not be revealed if the patient is not willing to know. Conclusion. Delivery of bad news is important aspect of job of healthcare professional. Proper training facilitates the process. Treat the patient as you expect yourself to be treated. It is not one event but a process. It is a team effort. A stepwise approach for breaking bad news should be used. Alan Phillips, it is bad news, but we just have to get on and deal with it. Thank you.